In what ways are you proud of Eden?
Oh my gosh.
Eden is so resilient. She has the best attitude. She's never been sick a day in her life, no matter how sick she's actually been.
Resiliency and just pushing on with a normal life, like nothing is wrong, because your attitude in life can really change your outlook in life, and she's got a great attitude. So
The part of her that just wanted to be a kid just like everybody else was just as important to her as the treatment part.
The story of her diagnosis actually starts before she was born. They took a bunch of blood and found out that I was a CF carrier. And then it turned out that he was a CF carrier. That meant that there was a 25% chance that any children that we had, not just Eden, but any pregnancies we had, would have CF. By the time she was diagnosed, it was no longer a surprise to us.
Cystic fibrosis is actually an inherited disease. It's a genetic disease. It especially affects the lungs, where it causes recurrent and chronic lung infection and chronic lung damage. It also has a big impact on the gastrointestinal system, where it affects how the pancreas helps people digest and absorb the calories from what they eat. And so people that have it from birth and have it their entire lives.
challenges, I would say, compliance obviously is, getting a small kid to commit to an hour and a half of treatment every day.
Sometimes it is very hard for me to remember to go to the nurse, take my medicine, or I'll eat a snack and forget to take my medicine. And sometimes all that would add up into a hospital visit.
Part of our job is to work with the entire family. Not only is a patient our patient, but their siblings are our patients, their parents are also our patients. We want to make sure that the family unit is working through this journey in as healthy a way as they can. So I've been privileged enough to get to know Eden's mom, her dad, her grandparents. That's a wonderful family.
As far as the care team, we have St. Francis has the Cystic Fibrosis Care Center, and they are approved by the Cystic Fibrosis Foundation.
We have a team that includes not just physicians. We have a pharmacist, we have a dietitian, we have a respiratory therapist.
We have seen Dr. Walter and Dr. Dramer have been there her whole life. And so it's pretty cool when we go to doctor's appointments, because it's kind of like family reunion.
Eden has shown remarkable courage after she had to get a port, which was kind of a life-changing procedure for her. She had to have monthly port accesses.
So I was going into surgery sometime, and with one of my special friends, and she took a puppet with a little port, and she told me all about it and what it was and why it was important.
So we worked diligently on techniques to help her cope with those monthly accesses, and she was willing and ready and able to do the hard work that it took to do those really hard things. She has shown remarkable bravery.
When I first saw Eden in the NICU, and I first talked to her parents about what to expect, I talked to them and I had to share with them that cystic fibrosis is a disease that was going to cut their child's life in half. We've now developed medications that allow us to treat the underlying problem. The main medicine we use in that group right now is called Trikafta, and it's really been a game changer. And now I'm able to share with her parents that I see a child who is going to have a normal, really healthy life and has a normal or near normal life expectancy.
It's been such an honor to watch Eden grow through this journey, through her dedication to her family and to herself. She has really discovered a lot about herself through this journey. I'm grateful for Children's Miracle Network, because without Children's Miracle Network, child life specialists could not do the job that we do.
There's so many people to thank, because it does take a village, and there's literally hundreds of people that help Eden's care.
They all did so much and kept me so healthy that I can live like a normal person without any sickness.